Hello, I'm Melanie Bernardin, and today we are in the NICU with Mr. Smith. His daughter Bethany is going home very soon. She was born at 33 weeks, premature, and is going home with oxygen. The reason why we're having this class today is so that Mr. Smith is comfortable taking his baby home and he's able to care for her properly. The first objective that we'd like to meet is proper hand hygiene. So let's get started. You ready to go to the sink, Mr. Smith?
I'm ready.
Okay. Okay, Mr. Smith. So I'm going to go ahead and demonstrate the proper way to wash your hands. We're going to use soap and water, though you don't have to use soap and water if you don't have it. It is preferred, but if you don't have soap and water or you're not near a sink, you can use hand sanitizer, but you need to make sure that it's at least 60% alcohol. So the first thing you want to do is wet your hands. Get enough soap so that you can get a good lather. Get some friction going on in there in your palms, in between your fingers, fingertips, knuckles. And you want to do this for at least 20 seconds. Or you can sing happy birthday twice. In fact, now's a good time to get your 3-year-old at home washing her hands. Okay, then we can rinse. You can tell her how important it is for everyone to wash their hands before they touch Bethany, the baby.
Yeah, especially with her baby sister's bad lungs.
Yes, that's a good point. Okay, do you have any questions before you wash your hands?
Looks pretty simple.
Okay, it's all yours. The sink is all yours.
I'll get my hands wet. Get enough soap here that I can work it into a lather. Make sure I get all the fingers.
You're doing a great job. That's some good lather.
Well, I was able to read those papers and watch those videos that you sent me, and they talk about how it's important to get your nails and your knuckles.
That's great. I was just going to ask you about those. I'm glad that you had a chance to watch them. I know that your wife couldn't come to the class because she was home with your 3-year-old.
Yeah, it's
so
pretty...
I'm counting on you to go home and explain all this to her.
I definitely will.
And you guys have access to the videos too and the handouts. So
we do.
If you have any questions, you can always let me know. Here's a paper towel. You can use a cloth to dry your hands as well if you don't have paper towels. You just make sure you use a clean cloth.
All right, makes sense.
Yes. Okay, great. Any questions?
Nope, no questions.
Okay, let's move on over to the table and we'll simulate oxygen placement on your baby. Okay, so here we are at the table. This is our little mannequin. We try to get mannequins that are as lifelike as possible. So first we're going to discuss the oxygen tank. This is a portable oxygen tank, much like what you're going to receive from your oxygen supply company. And one of the safety measures is that you don't want it to be standing up. You want to make sure that it's lying down, especially when you're taking her for her doctor's appointments. So it'll come with a little case. Make sure it's zipped up and laying on the floorboards of the car. Also, you don't want to keep it in a room where somebody's smoking or anything that could cause a spark in the bedroom or anything that has like hot oil. I know you work in, you're working in auto.
I'm an auto mechanic.
Auto mechanic. I'm sorry. Auto mechanic. And so you probably do use some flammable materials or yeah, okay. So you understand, I'm sure. You want to be careful. So also, I know that you were reading the information that I gave you on oxygen tank safety, and can you tell me about a little bit about the regulator and how to know when it's full and when it's empty?
Yeah, if I remember correctly, 2000, the needle should be in the green and it should read 2000. once the needle moves out of the green, it's time to contact or my supplier and get more oxygen.
Yes, that's great. Perfect. I couldn't have said it better myself. So you just want to make sure that you keep an eye on that needle and that it's not getting too low. Okay, so the next thing we're going to do is we're going to apply the nasal cannula to the baby doll. Bethany's going home on 1/2 liter of oxygen. So you want to make sure that you know how to regulate that with your key, how to turn it on and off. And you want to make sure that it's off when it's not being used. Otherwise, you can waste oxygen. So to apply the nasal cannula, the prongs need to be pointed down. You put them inside her nostrils, not too far in, because you don't want the septum of her nose or the skin between her nostrils to rub up against this plastic part here, because that can irritate her skin and cause a skin breakdown or damage. And it can hurt her too.
Yeah, she'll fuss if that happens.
Oh gosh, yeah, that wouldn't be fun. So I'm using sensitive tape here, or tape for sensitive skin. You can get that at any medical supply or pharmacy, and you just hold it in place as you're taping it, and then you can adjust it in the back for her comfort.
Okay.
You don't want it to be too tight so that it's touching her skin, because that can cause breakdown as well. But you don't want it to be too loose so that she can grab it and pull it off. I've seen it happen.
Okay.
Okay. Are you ready to try? Do you have any questions before?
So I tell the pharmacy skin sensitive tape?
Yes. There's some companies that make it. It's usually in the first aid section of the pharmacy, or you can go to like a Walgreens or CVS. You could even order it off Amazon.
Okay.
And it's just sensitive tape for sensitive skin.
Yeah.
And it also says painless removal.
Perfect.
On it. Okay. Any other questions?
No, that's it. I think I have a good idea how to do it.
Okay, great. Well, I'm going to let you go ahead and practice with the mannequin.
Okay.
Do the simulation.
All right, Bethany, you cute little young miss.
She is super cute.
Put the nasal cannula in your nostrils. I'm making sure the prongs are down. I'm going to insert it all the way, but without having this plastic piece touch her nostrils. So I'm just going to hold that in place while I put the skin sensitive tape on there. Tape it in place. Tape the other side in place. And I'm going to make sure that, as you mentioned, that this is in a good position so it doesn't bother her. She can't get her hands tangled up. And then I'm just going to take up the slack with this right here. And that's it.
For older kids and adults, you can actually put this around their ears and actually tie it in the front. But for babies, I recommend putting it in the back, because they can end up pulling it out very easily with their hands.
Okay, makes sense.
Okay, great. Do you have any questions? You did a great job.
Thank you.
I think you're ready.
Thanks.
You feel ready to take your baby home?
I feel, yes, I'm getting more and more comfortable, actually.
Yeah, great. Yeah. I know it's a nerve-wracking thing to think about, but you guys are going to be just fine.
Thanks.
Okay, are you ready to move on to respiratory distress?
I am.
Okay, let's review respiratory distress. I know you had a chance to watch the video about the signs and symptoms of respiratory distress and the warning signs that your baby may be in distress. Do you have any questions?
No, just a little nervous.
Yeah, that's understandable. We want you to feel comfortable taking your baby home, and that's why we have these classes. Do you feel more comfortable?
I do. After watching the videos, yeah, I feel more comfortable that I know what to look for.
Okay, great. Well, it's your job to teach Mom, because she couldn't make it today. But that's okay. This is actually what you did with the nasal cannula on the mannequin. It's called Teach Back. It's where you're teaching me how to do it, and you did a great job. I want you to do that with Mom.
You got
when you
it.
Get home. Okay. So can you name 3 symptoms or signs that your baby is in distress?
Yeah, I believe I can. The just visually looking at the baby after watching the videos and reading the documentation you gave me, I know that their skin turns blue around their mouth, their lips, on the inside, and even on their chest and stomach. So watching for skin color would be one of the things to identify. Another thing I remember watching the video visually was one of the babies trying to draw in breath, and you can actually see the skin stretching over the ribs.
Yes.
And yeah, pulling their stomach in. I can't remember what they called it, but
Retractions?
retraction. Yeah.
Yes. That is a telltale sign that your baby can be in distress when the skin is pulling in between their ribs. That video is actually has a pretty good image of
It
what
does.
it looks like.
Yeah, I could tell that baby was struggling for breath.
Yeah. So also the baby can increase her work of breathing. So it's not necessarily just the skin pulling in with the retractions, but also breathing fast. That's called tachypnea. It's also information on your handout. It just means the baby's breathing fast, and usually that means they're not taking deep enough breaths because something's wrong. So we want to make sure that you know these signs so that if you see any of these in Bethany, that you can let her doctor know or bring her to urgent care or the emergency room if it is serious.
Okay, yeah.
Can you name one more symptom or sign?
Yes, I can. I think they called it apnea. And so if you're watching your baby breathe and you notice that there's a long pause in between breaths, they call that apnea. And so I believe that was another sign of breathing distress, when there's long pauses in between breaths.
Yes, babies do not breathe at a regular rhythm like adults do and older children. They actually have an irregular rhythm. So they can breathe quickly and then stop, and then breathe again and then stop. That's normal. But if it goes longer than 20 seconds, then it can mean or be a sign that your baby is in distress. So you want to make sure that you are looking for those signs and symptoms of her holding her breath.
Yeah, I understand.
Great. Okay. Do you have any other questions? You did great today.
Thank you. I don't think I have any questions. I think I'm going to teach my wife right away while it's fresh in my mind.
Okay. One other thing I did want to mention, part of the symptoms, or one of the symptoms, excuse me, that you want to look out for is if your baby has loud breathing. There's something called grunting, where it actually sounds like they're sighing, or we call it singing sometimes. That is also a sign of respiratory distress. Now, you and your wife have access to the videos that you've seen and the handouts that I've given you. So if you ever want to look at it again, or if you have any questions, you can let me know. But you have access to those videos already. So do you feel comfortable taking Bethany home?
Much more comfortable.
Okay, great. Well, that's the reason why we have these classes, are so that parents feel more comfortable and are more confident in caring for their baby when they go home.
Thank you.
And that makes us feel more comfortable and confident sending your baby home with you. Well, you did a great job today.
Thank you.
You're welcome. Well, I think that was a successful class. Mr. Smith feels more comfortable taking his baby home. He feels more confident about caring for her and the equipment that she's going to be going home with. That's the goal of these classes, is to make sure that the parents are comfortable in caring for their baby at discharge. He was able to meet all the objectives: hand hygiene, placing oxygen on his baby via nasal cannula, and being able to name several symptoms of respiratory distress. The multidisciplinary team helps the parents along the road during the baby's stay in the hospital. But these formal classes help one-on-one or with another parent so that they're confident and comfortable taking their baby home, which I believe Mr. Smith is now. Thank you.